A very good afternoon to everyone. I'm Dr. Isha Angne. I completed my post-graduation with oral pathology after my graduation, and my special interest is pediatric dentistry. So currently I'm pursuing my MSc at Eastman Dental Institute in London. So basically today we are here to talk about how to prevent caries in children and how to treat caries in children in case your baby does have caries. So now, essentially, talking a little about pediatric dentistry first. Here we have our center in Malad in Mumbai. It's me, Dr. Isha Angne, and Dr. Mihir Shah here at Pediatric Smiles. And the reason why this is exclusive is because children's dentistry is very much different from adult dentistry. And beyond that, we try to do here is critical for your child so that they feel comfortable to do a dental treatment. Now, coming to our topic, which is prevention of dental caries. The very key thing to understand about dental caries is dental caries are 100% preventable. If you take good care of your child's teeth, then you will never have to deal with the problem of treatment of dental caries because it's 100% preventable. So now, how do you start with preventive care of your child, and when does it start? So the preventive care of a child starts at the time when you're pregnant with your baby. Okay, so the mother's oral hygiene also affects the baby's health. So you have to understand that there are research papers done, there are studies done which show that mothers who suffer from periodontitis, who suffer from dental problems of the gums, have low birth weight babies. So now this is just one study, but in general, taking care of your oral hygiene is a stepping stone to preventing caries in your child. Okay, so now what do you do after your child is born? How do you prevent caries? So for initial 6 months, when the baby doesn't have teeth, he has something called gum pads in his mouth. So now, cleaning of gum pads is controversial, is recommended at times or not recommended. But what we recommend is maybe you just give a little bit of water probably after breastfeeding. Initially, when there is exclusive breastfeeding, maybe not there. But later on, as you start giving other foods with breastfeeding and you start weaning, that is when you start cleaning the gum pads, you start giving a little bit of water, especially after night feeds, so that the milk doesn't stay in the mouth. Usually, as we spoke about in the last lecture with Dr. Mihir Shah, that teeth erupt around the age of 6 months in a baby, and they keep erupting up to 3 years till he has his full set of milk teeth. So now, how to take care of these teeth? The key thing to understand here is that you have to start brushing and you have to start cleaning the moment the baby's first tooth is seen in the oral cavity. So now, how do you do this? The baby is tiny, you can't put a brush inside. So you can use a sterile gauze. Sterile gauze is available at chemists very easily. You can take that. I'll just show you how. You can wrap it around your finger, open the child's mouth, and gently clean his gum pads. I'll just show it to you in a moment. And beyond that, you can give, especially after night feeds, you can give a little bit of water to your child, and that will be helpful. Just that will be helpful. And beyond that, when the teeth erupt, there's something called as a finger brush that is available. So it's a plastic sleeve brush that is available with which you can clean your child's teeth. Once the child gets now, the guidelines, according to the guidelines, in 0 to 2 years of kids, a non-fluoridated toothpaste should be used. From 2 years to 6 years, 500 parts per million of fluoride. Toothpaste, you can just check behind your toothpaste, it's written 500 ppm F. That's parts per million of fluoride. So for 2 to 6 years old, you can use a 500 parts per million. For 6 years and beyond, 1,000 parts per million is recommended according to Indian guidelines. So now, how much toothpaste do you use? If your baby is initially, you use toothpaste. And if your baby and he can spit very well, then you can use a pea-sized toothpaste on your toothbrush. Okay, and the fluoride recommendations are according to the age, as I told you before. Okay, so now let's see what else can you do in preventive care. In preventive care, this is what I was talking about. Appreciate a rice grain size toothpaste according to ages. Yeah. The second thing that can be done in a baby's child is flossing. This is a floss with a handle, and this is a floss. without a handle. This is a little difficult, but if you can teach your child practice, that will keep decays away. So now, what do you do? What else do you do from preventive point of view? It is recommended that the child undergoes or sees a dentist or at least a pediatric therapist once a year as soon as the tooth erupts. Okay, so you have to visit either a pediatrician who is trained in looking at baby's oral cavity, or you can look at a pediatric dentist who are specialized in this. Yeah, so this is how very young children are observed and are checked for dental caries at a very young age. Yes, and this is the sterile gauze pad that I was talking about, with how you can clean your baby's initial teeth. Okay, now what else care can you take? Now you have to understand that dental caries are transmissible. That is, dental caries, where do these germs come from? They have to come from somewhere, right? So the dental caries germs come from people who are around the baby, the family of the baby. Okay, so everybody who's interacting with the baby. So that is how the germs are transmitted on, probably with the sharing of a spoon or just cuddling, kissing. So yes, so now that you know that this happens, so you have to be very careful that you use different cutlery for the child. Essentially, try to stop transmission as much as you can. So now, which bacteria is responsible for these caries? Are all bacteria bad? No, all bacteria in our oral cavity aren't bad. Streptococcus mutans is the one bacteria that has been found to cause cavities, and we do not want this bad bacteria to colonize our baby's teeth. So if you maintain good oral hygiene, if you take all preventive measures, you can ensure that there is good oral microflora in your child's mouth. Okay, and that is what we should aim for. All right. So now, what do we do in case our baby in cavities? Now, what should be what? How do I know that there is cavity in a baby's mouth? Okay. So initial cavity would look like something whitish, but you could usually see something like brown stains occurring on that, which you might mistake for stains. So see a specialist in case you see anything like that on your baby's teeth, because that could be a cavity. Now the thing about dental cavities is that the earlier you treat them, the easier the treatment is. The later you treat them, the more difficult the treatment gets. So it's always preferable that the moment you see something unusual with your baby's teeth, you immediately report to a specialist pediatric dentist, preferably, so that it can be taken care of as early as possible. I'll just show you in brief what dental cavities and the stages of them look like, so that now you know. So this is our normal tooth. What you see outside is enamel. What you see the next layer is dentine. What is there inside is the pulp. Okay, so these are nerves and blood vessels which come into your tooth, and they are called the pulp. All right, so now can you appreciate this? There is a blackish area forming here in the tooth here. Yes, so this is an initial cavity. This a pediatric dentist can easily clear out with just the dental filling. Your baby will not have to undergo a lot of treatment. Okay. Currently, there are advancements which are available, which is called a silver diamine fluoride. Okay, so this is for babies who are very young, like younger than 2 years of age, and immediately started having cavities because oral hygiene was not maintained. So in such babies, we have something called as SDF, or silver diamine fluoride. We apply to the baby's teeth. Tooth decay. It actually stops the tooth decay. Okay, and then this is an intermittent treatment. This is not a complete treatment, but this is done so that the cavity does not progress to a greater stage. All right, and the baby doesn't have pain. So for 6 months, once the baby is older, we do a full treatment. All right. So now let's look at what is the next stage. So this was an initial cavity. So this is when the cavity gets deeper, and this is when it goes to dentine. This and this are the stages where the baby can have pain. Okay, and the treatment does get a little tougher, but it gets the toughest when it goes into the pulp. And here we have to do something which is called as the root canal treatment, the very dreaded treatment by adults as well. Okay, so we do not want any children to undergo this treatment. So the moment you see a cavity, immediately report. Once this happens, there is nothing else that we can do. We will have to do a root canal treatment. There are different kinds of treatments for baby teeth that are available, and we will talk about these briefly as to after a little while further. Yeah. So now this was all about prevention. A very key thing to important remember in prevention is this. Yeah, don't introduce any sugary foods to your child. And for young children who are weaning, all right, do not give sugar coated pacifiers. uh, do not introduce added sugar or free sugars in weaning foods. As far as possible, keep the food natural. Yes, because there are a lot of natural sources of sugar. You do not have to add sugar to a baby's this thing. So as far as possible, do not introduce sugar to a young child. Yes. So now going on further as to the treatment options that are available. So what are the treatment options available? Now there is a large range of treatments that are done. Treatments that are done for teeth, for cavities in teeth, and then there are treatments done for teeth that are malpositioned. So your teeth, maybe has crooked teeth, or you see something, one teeth is behind, one teeth is ahead. What do I do? Yes, so those come under myofunctional and orthodontic treatments, and dental cavities come under restorative treatments. All right. So now, what are the restorative options that are available? The restorative options that are available are what we generally call as fillings. Okay, so there are different kinds, and mostly we do tooth colored fillings for the front ones as well as the back ones right now, because other fillings, there are several advancements and all these fillings are currently available. So now let me just show you what all restorative treatments options are available in a child. So yeah, here we go. So this is a case of grossly decayed anterior teeth in a 4-year-old child. Yeah, and we restored it to this condition that you can appreciate here. This can be done by tooth-colored fillings, or these can be done by crowns, which are zirconia crowns they're called. They can be luted onto the teeth. Uh, Tooth-colored fillings suffice as well. And for back teeth, whenever there are cavities, crowns like these are done. These are stainless steel crowns. So these are not like adult crowns. We do not take measurements for these and make these. These come pre-formed. These come in different sizes, and we fix it to a baby's teeth. Why is such extensive treatment important? For this, I will refer you to our previous lecture of why milk teeth are important and why it goes into the pulp and causes a caries in a tooth. So for such treatments, we do a pulpotomy or a pulpectomy. Okay, so what does a pulpotomy or a pulpectomy look like? In this, we remove the nerves and the blood vessels that are there in the tooth, because they're obviously dead and they're obviously infected, and we fill them up. We fill them up with with different materials. They aren't filled up with materials that are used in adults. These are different materials. So milk teeth have to eventually fall, right? So when we do a root canal of a baby's teeth, we fill it with materials that can be resorbed. What does that mean? These materials these materials melt away. These materials melt away when the new teeth is coming from below. So this is what a root canal of an anterior tooth will look like, which has a single nerve. And this is what the root canal of a multi-rooted or a posterior tooth will look like. Can you appreciate this? Yes. So this is a multi-rooted back tooth root canal.